Wearable technology for general practice. Is that a thing or is it hype? We're going to cover that for you in this episode with myself and Andy, and we're going to basically fill you in on our experiences using some wearables, consumer-based, and take it from there. Let's take an answer to primary care and learning.
Right, that sounds fantastic. So, welcome eGPlearning Podblast listeners and viewers on YouTube. It's great to be back. We've had a bit of a hiatus over summer, but we're back with you now.
So we apologise to our listeners on that basis. Both Andy and I are clinical directors, and we're going to talk a little bit about that actually in our recap, but that's taken up a lot of our time, as some of you would gather. But we're back. We're here to give you our episode on wearable technology, to explain basically our experiences and stuff, and fill you in on some of the things that we've been up to as well.
Yeah, and we've been planning to do this episode for a while, so I'm quite excited to be finally sitting down and filming it.
Definitely.
So shall we put out a mention for some of our loyal followers out there, Gandhi?
So despite us being away, they've still been championing us and supporting us and stuff. So hi to JC Melody, to Sonali, to NCGPA, Notsel MC, James Tambaraja, and Nikki Kanani, massive fan of our show. It was great having her on a while back, and it's still probably one of our most popular episodes going. And she's clearly busy right now. And congratulations to her on being appointed officially as the primary care director with NHS England.
Yeah, congratulations, Nikki, and you keep popping up on my phone all the time in WhatsApp.
Definitely.
That's great.
Keep massive Twitter maestro as well. You know, if you want to go learn from her or from me. But yeah, definitely Nikki knows how to use Twitter.
Excellent. So today's topic is wearable technology in health and also in primary care. So we'll be diving a little bit deeper into that topic. And as Gandhi says, I'm owner of an Apple Watch, so I can speak from that experience. Gandhi has a few devices. Yeah,
so I'm, as many of you know, I'm not so keen on Apple products and stuff, so I've got a few of the other ones that we can go through. And yeah, we're just going to have a chat about all those kind of things.
Good. And I suppose very quickly, before we start, have you been up to anything exciting in the last few weeks or months?
A couple of things. So it's conference season, party political, but as well medical. And for those of you that are RCGP members, you're more than welcome to come and see me at the RCGP conference in a few weeks' time, where I'll be talking about using technology, as you'd expect, really. But a great session, hopefully, with myself, John Griffiths and Ben Gallen, talking about podcasting, blogging and vlogging, and why you might want to do it in general practice and stuff. Also speaking at I'm an Aurora's conference in terms of big trainee conference. Yeah, definitely if you guys are coming to that, you'll be seeing me. Did one a few weeks ago. It was amazing, great feedback and stuff, and you know, speaking to people at that, the session was great. And the big thing for me, so this might be out by the time you guys see this episode, but in the past couple of years I've had a couple of mentors, both personal and ethereal, because they're on the web and stuff. For me, one of the big ones is a guy called Pat Flynn. It's a lot about how to use passive income, but more importantly, developing and structuring your business and all the stuff that I know about marketing, YouTube, podcasting.
I'm a fan of Pat as well. Yeah. He's a bit of a guru in terms of people developing podcasts and sort of online presences and products. He's fantastic. So it's a bit of a virtual mentor, as they say. And Pat does a podcast called Ask Pat, where people who are a little bit sort of behind Pat in terms of Pat's a megastar, but people who are a few steps behind Pat in terms of their journey on social media or YouTube or podcasts go on and they have a little mentoring session with him, and that forms one of his podcasts, and Gandhi was on, so I'm really excited to hear it.
So by the time you guys are watching or listening to this episode, that should be out if you want to go check it out. As far as I remember, it's episode 1089. He's done that many, and yeah, feel free to go listen to this. Ask Pat 2.0 episode 1089. Love your feedback, love to know what you guys think. He doesn't really interview people from the UK as well, which is, I think, you know, occasionally he's had a few people on. I think I'm like the 5th or 6th person in that 1,000, so massive, and great shout out Pat. He, you know, for me, he's a massive mentor.
I bet he found it interesting having someone from the UK on, I guess.
Well, a doctor as well. Yeah. He's, you know, talking about the kind of medical aspect of it, because we talk about that quite a lot in the episode, and the conflict that I have of obviously being a GP and working and trying to balance that with some of the other stuff that we do. Yeah, that happens all the time, doesn't it? So we talk quite a lot about that side of things, and his, trying to help him understand how healthcare is different in the UK compared to America. We briefly cover that, but
I bet it's a fascinating episode.
Go listen.
So what have I been up to? Well, I'll use this bit just to highlight. So I've been working on, along with Gandhi, the digital GP fellowship, which we're getting up and running here in Nottingham. Opportunity for first 5 GP, or actually we've got a number of places available, but for first 5 GPs to start to develop a portfolio career that includes some aspects of healthcare technology, working 2 days a week in practice, in an approved practice, 2 days a week working on project work with one of the sort of technology players regionally, so connected Nottinghamshire, NCGPA perhaps, or other places where they might be placed to do project work to really work out how we're going to meet the digital challenge and deliver things like video consultations, electronic consultations, look at digital literacy in the workforce and in patients as well, and address all of these problems, and also be funded for 1 day a week to do a approved qualification as well. So great opportunity. There'll definitely be some details in the show notes, and maybe even flashing up on screen depending on how we're feeling about that. But really encourage people to apply for that fantastic opportunity. So I've been working trying to promote that. Cool. Shout out to our sponsors. I'm going to see if I get this right. So Health Technology News is a health technology newspaper. It's an innovative daily news and opinion website for the healthtech network. And those guys are great.
Definitely. So they've asked us to be part of their HTN Digital Week again in January. So you guys may remember those episodes we did on how to work quicker in general practice, and our previous ones about tech to enhance your CPD, social media, and all our top 5 apps and stuff. Big shout out to their awards that they've just had recently. So they've ran this awards session about looking at health tech in medicine, basically, and there are aspects of primary care. Just to mention a couple of the winners, because I think these are slightly relevant to what we do. So in the primary care innovation, they had the Eastern Academic Health Science Network. They've created a digital officer placement, and that won the award category. And the runner-up, highly commended, was Practice Unbound, who basically have created lots of different mechanisms to help primary care and general practice save time with like workflow work and stuff. And I've been listening to quite a few of their head I've forgotten his name, unfortunately.
I've forgotten his name as well.
But they've been on Ben Gowland's podcast, our friend from the General Practice podcast, a few times, and talking about how to streamline your primary care system. Definitely worth the runner-up, if not the winner in my view, but
I would say, and that podcast is probably essential listening, particularly if you're working in primary care networks, because he's really been focusing on that. So big thanks to Ben for all the work that he's been doing around primary care networks, clinical pharmacists, social prescribers, all of those things. Fantastic work.
And I think the award will cause a little bit of tension for some of our listeners. So the winner of the Excellence in Mobile Healthcare, Babylon. Worth having a look at, I think. So we'll put the link to the winners and stuff. You guys can have a look at that. Definite shout out to HTN. You guys, thanks for supporting us, and check them out, guys. It's where we get all of our health tech news from. So
cool. So diving in. So wearable technology, or wearable technology in health. So Gandhi, help us out. What when we say that, what do we mean?
So wearables is basically any device that you can wear. And when we're talking about it from a health perspective, it gives you some sort of metric or something that you can then use to try and change your health. That's the basics, effectively. Yeah. And if you think about it, we've kind of had these kind of technologies for years, but we've just not thought about it in the same way. So things like, thermometers is technically a type of technology, gives you metrics. May not always be wearable, but there are a couple that you could, have on you and stuff. Pulse oximeters was something that,
it's overnight pulse oximetry.
Exactly. I guess. So clinics have been using that for several years. Some of them, unfortunately, were a lot more clunky, so big, huge machines, so they weren't exactly wearable in the sense of portable. But, when you go to sleep, the machine's there, you stick it on your finger, and that gives them the metrics to help diagnose whether or not you have obstructive sleep apnea or not. So this kind of technology has existed for a while. We're seeing, other kind of enhancements in the past, so things like hearing aids and insulin pumps, continuous delivery insulin pumps and stuff that some patients have had, and those kind of things. But today we're going to talk a little bit more about consumer-based wearable technology, aren't we?
Yeah, and I was going to say, I think recently something exciting has happened, not just affecting wearable health tech, but other aspects, because these things they've existed for a long time.
Mm-hmm.
Things that you wear that collect data or make some sort of intervention to help with your health. But they've always been big and they've always been quite expensive.
Yeah.
And what's happened recently is the mobile phone revolution. So because of the volumes of mobile phones that are made and sold, and the desire to have things in them like cameras, like accelerometers, and increasingly, particularly smartwatches have been developed, the ability to measure things like pulse oximetry, things like that. These sorts of GPS sensors as well, they're everywhere. These sort of things have really come down in cost, they've really come down in price, they've really come down in power consumption. And so it's now becoming possible, perhaps for the first time, to actually make affordable, fairly appropriately proportioned and truly wearable, that you can actually take with you and wear during your day, health technology. So it's quite an exciting time, I think.
Is. And so that's what we're going to talk about. So the fact that these things are available and wearable is great. The big question that every clinician always have, but is it useful? Is it effective at looking at healthcare? And that's the part, and that's the question that many people struggle to answer.
Or does it just add to the confusion?
Yeah, exactly. So we're going to cover that quite quickly. But definitely the availability has helped. I think no one can question that, and I think particularly the smart watch aspect of it. So, on your phones, I remember a few years ago where they had pedometers, and you could actually track your fitness steps just by how your phone went. It wasn't as accurate because it was based on where the phone was kept, and obviously you keeping the phone with you. Now, the fact we've gone down to watches and other kind of devices that we're going to briefly cover as well. It's just so much more accessible, isn't it?
Yeah, it's great, and I guess what we'll be focusing on today is probably the smartwatches, because we've had experience with those, and I think what we're looking at is probably more the consumer side, isn't it? Because we alluded to things like insulin pumps and so forth, and those are definitely coming through and benefiting from the reduction in size of sensors and so forth. But just to sort of guide people today, I think we're probably more focused on what I would call consumer health and fitness, I think.
And I think the reason why we're doing that is simply just because it's more available, more usable by your patients, which may be something that you see more often. And also a lot of the more specific tech is for clear reasons. So there, for example, there's a smart sock out there that's used for analysing your tissue perfusion post-surgery to see how well your wound is healing and whether other kind of things need to be considered and that kind of stuff. That's not something that you're going to see the run-of-the-mill patient come up with, or your run-of-the-mill practice, whereas something like an iWatch, almost half the people that walk through your room may have one.
Yeah, well, that's the difference as well, because I think some of the more complicated health-driven technologies medical-driven technology, that's driven by us, by the GPs and the doctors. The consumer health and fitness technology, that's happening regardless of what we're doing.
Yeah,
I mean,
exactly.
it's coming. People are getting their watches. They're coming along, showing me readouts of their pulse rate, and I think we just need to learn to cope with that, because we don't have as much control over whether or not they do it and whether or not they get worried about it.
Yeah, so if you're watching or listening to this, give us a shout out. Have you actually had the consultation where a patient comes in and says, my iWatch tells me my heart rate is doing this? Because I know I have.
Yeah, I have, yeah.
Yeah, how have you felt with that? How's that gone? We'd be interested to hear your stories on it, and we're going to share you ours, but yeah.
Good. So I guess I like to break things down a little bit. So what can health technology, or what does it currently do? What might it do in the future? What do we think? Can we break this down?
So I think in terms of what it can do at the moment, so these devices can do a variety of things like track your vitals. So obvious ones are pedometers. That's where it kind of started. So companies like Fitbit and Jabra, something or other. There's another company so they were the key leaders originally.
I think Jabra's gone, or is it still?
Yeah,
Jawbone.
Jawbone, that was it. Jawbone was the original one with Fitbit, and so they were the kind of like the Apple and Google of health of trackers and that kind of stuff. And then as the technology's improved and stuff, obviously we've seen the bigger companies come in and have an impact. So Apple, Google, they're playing a much bigger market and integrating them with their smartphone technologies and other platforms and stuff in modern life. So, but the main thing is definitely metrics in terms of health. So pedometry, many of them now contain heart rate monitors as a common feature that you would see. Some of them contain pulse oximeters. ECGs we're starting to see, blood pressure monitoring even to some degree we're seeing, and I think we're going to see more. I think the Apple Watch also has a few extra kind of things like falls prevention.
Yeah, I was going to talk about that a little bit later. We'll save that one for later. But that's a feature that's actually impressed me recently.
Cool.
So I guess in summary, I guess what we're saying, just to summarise what you're saying, Andy, is I guess they can do a number of things. So they can capture information.
Yeah.
So a lot of it is about using all of those sensors to capture all of that information. And then obviously there has to be some processing step. You've got to do something with that information. And I think that's where, as more information is available and people look at it and analyze it, I think that's a real area where there can be a lot of improvement and will be a lot of improvement. It's going to make sense. The device or whoever off the device is looking at it's going to make sense of it. And then there's always the opportunity for it to intervene as well. So these watches can give us notifications, nudges, not just watches, devices. Sometimes they can even actually do a medical intervention. If we're going back to things like insulin pumps, they can actually do something medical as well. So, capture, think about it, and intervene. I guess that's what they are doing. Cool. So, Gandhi, what's your experience of wearables been? Either personally or in terms of your professional life and dealing with patients. And give us some.
So personally, they've had quite an impact actually. So about 4 years ago, I was training for the half marathon, and that was probably my first exposure to wearable tech because I got a Fitbit to try and track my steps because it was this kind of thing. I was running, I was walking, all that kind of stuff. I wanted to know how well I was actually doing. I could track my distance or my time, but not any other kind of stuff. And I also wanted to track my calorie intake. And Fitbit at that time had an app that allowed you to do that. Basically, you put what you've eaten in, it, allocate calories to it, and it works out how much you should have burnt off to kind of get that balance. And I was always on this basis. As long as I intake was less than what I was burning off, I'd always lose a little bit of weight, and theoretically that should help my fitness and all that kind of stuff. Anyway, so that made a massive shift for me. I lost about 9 kilos in weight whilst training for a half marathon. I managed to track exactly how many steps I was doing over that point, and it was like, okay, I managed to get to 20,000 steps, 30,000 steps. Day of the half marathon, 70,000 steps.
Okay, that's a lot of steps.
Yeah, but that was my first positive experience, and the metrics I got from the watch helped fuel and maintain my activity, because I then realised on certain days when I hadn't done as much, not done as many steps. That's not good. That's not what I'm trying to achieve. Most interesting thing I found, whenever I was at work, my steps dropped like a lead balloon. Absolutely. And that's something I've taken back, and as many of our listeners and stuff in the eGPlearners will know, since then I've started doing other kind of things, so like my standing desk, for example, to try and shift how I do things personally. So for me, that really started to change in terms of a lot of my lifestyle kind of stuff and things. It went up and down. It keeps doing that. Yeah, that's always the case, isn't it? But it definitely made a profound change.
So I've got a question, Gandhi. So there was a point in time where you got your first smartwatch.
Yeah.
That was maybe your Fitbit or whatever. Have you always worn a smartwatch since then? Are you still wearing a smartwatch?
I pretty much consistently had one. There was a period where my Fitbit broke, so I went without for a short period of time, and then I got a bit bored of not having the metrics and stuff. So then I went back and got a different kind of watch and things, and pretty much consistently since then I've had something. I've gone through a few different iterations. As I said earlier, I'm not the biggest fan of Apple products. Some of them are great, but I'm not a fan of the iPhone specifically, and therefore not having an iPhone means using an iWatch is kind of counterproductive.
It's impossible.
Yeah.
You currently can't do it.
Yeah.
Maybe in the future.
And I think that's one of the reasons why I've looked at other options outside of the iWatch. Now, the iWatch is clearly something that people could consider. You're probably a better person to speak on that.
Yeah, I'll talk about my experience. So I got one of the first Apple Watches. I was quite excited about it. A bit more of an Apple fanboy in those days, and would watch the Worldwide Developer Conference presentations and all of that stuff. The first device lacked a few key features, I think. So it would count your steps, give you some information about your calorie consumption, but there was no GPS tracker. And and at that point in time, and still, but to a lesser extent, I was quite into jogging and running. So for me, it was getting something that was new and exciting, and also something that I thought might help in terms of keeping an eye on my running and my running performance. So that was why I did it. So I had the original one, and then when the Series 2 came out, as soon as they integrated GPS, I got the next one, the Series 2. I'll show you on the camera in a minute. So that's what I've got. Apple Watch. I'm actually a fan. So of the Apple Watch, but also of the category in general. So some of the features of the Apple Watch. So GPS introduced in Series 2, but you can now, on the more current models, there's actually an ECG monitor.
Yeah.
So that's one of the devices that does have FDA approved ECG recording. There's cellular connection. This is something. So safety is something that you might not initially think of, and maybe we're straying a little bit away from primary care here. But a few years ago, I had an episode where I witnessed. I've never told you about this, Gandhi. Don't worry, it's not too traumatic for me. But I witnessed some domestic violence occurring at a bus station, at a tram stop actually, and there wasn't very many people around. In fact, there was only me and lady with a pram, and was probably her partner, and he was knocking her, hitting her and knocking her around, and I wasn't quite sure what to do. So I rang the police and got on the line with the police, told them that what was happening, and sort of made it clear that I was talking to the police while it was happening. And then this chap came up to me and started trying to wrestle the phone out of my hand and do all, and we had a little bit of a scuffle over the phone, and then he ran away. And after that, I had the watch, and I could have made a call on my watch instead. And I sort of mentally drilled myself now that if there's ever sort of a similar situation, I'll just make the call on my watch, because then you've got both your hands free to grapple. Anyway, that was a little bit of an aside. But actually having that connectivity that's strapped to you is useful and feeds into some of the other functions as well. The other thing, falls detection. There was a story recently in the media about a chap, I think he was in America, and the Apple Watch comes with something called hard fall detection. So there's a softer fall detection where, if you fall in your, elderly person falls in their home, you can notify somebody. But for everybody, you can activate hard fall detection. So if the watch detects something that it thinks is a hard fall, so like a fall from height, a car crash, something, with the accelerometer, something that's quite significant, and then it detects that you are inactive, as in not moving for 2 minutes afterwards, but still, alive and warm and connected to the watch. It will call the emergency services for you and also notify nominated people and it will send them your GPS location and tell them where you are. And anyway, chap involved in a car crash in America, middle of nowhere. Nobody would be aware where he was, but his watch called the emergency services and saved him. So not primary care, more emergency care, but just in terms of preventing death, I think that's quite a useful feature and well thought out, I think.
I think it shows that these companies have thought about the impact this will have on particular patients and stuff. I'm slightly more interested in the soft fall prevention, but though, if I'm being honest, because using that in our elderly population, and so we have fall prevention devices that people use in primary care and stuff, but they're often quite clunky. They're generally okay, but they're not multi-use. And I guess the benefit of things like the iWatch or smart watches is that they have other uses. So it's not just that you've got this clunky piece of kit that you can only use for one thing and that you have to remember all the time. If it doubles up as a watch, as a communications device, actually with our elderly people that can stay at home and are safe to stay at home, but occasionally just need that extra cushion support and may not have the same level of social care or supportive care that they need, it can give you a bit more safety.
If you fall and then someone calls you on the watch because maybe you've left your phone in the kitchen, are you okay? Yes, no, do you want help? So I think there's a lot of
from a communication point of view, have you remembered to take your meds?
It can prompt you notifications.
I mean, it does feed into that aspect though of big data, I guess, is one of the concerns, but I think we'll cover that later.
I was going to say, you're going there yet?
Fair enough. We'll come back to that, guys.
I've got a few things just to say, but just while we're at it. So the Apple Watch is one of those where people have come telling me that it's told them that they're having an arrhythmia before as well. It's got arrhythmia alerts, and the common ones I get is, it's telling me I'm asleep at night. I have woke up feeling funny, but now I've got evidence that my heart rate's 180 when I'm not doing anything, for 15 minutes at night. And we've looked into that. Sometimes they've not been symptomatic, and it's said that. And we've obviously, we have investigated that and sent them for Holter ECG, but the question is, how often does that happen in a healthy population? Is that actually relevant? Is that pathological? So I think that's something that we'll need to, as a profession, begin to to learn as we get so much data that we wouldn't have had before.
The problem is that's also where the suspicion comes from the medical community in terms of how these technologies work. So as you mentioned, the iWatch is FDA approved. That's not, unfortunately, UK-based level approval. So in terms of the kind of equipment we would use in the UK, it doesn't fulfil the criteria. That doesn't mean it's not effective. Be absolutely clear on that. But at the same time, it's not the same kind of criteria that we would consider in the UK, which is why, like you said, you then reinvestigate it. And that raises questions about doubling up of workload, I guess, if it is valid and that kind of thing. But then the other part is, yes, the iWatch is FDA approved. A lot of the products that have ECG monitors and that kind of stuff do state this is not for medical use. So therefore, how reliable are they? So for example, I've got my previous device that I had here. So this is a Letscom band, effectively, very basic kind of thing. So I'm going to put it here. So for you guys, and then for you guys, that's what it looks like. Very simple little band, as you can see. Not a massive digital interface like the iWatch would have, and it's got very limited metrics. So this gives you pedometer, this gives you heart rate, this gives you notifications from your phone, that kind of stuff. And you can even control the camera with this one. This is 17 quid. Bargain, absolute bargain. I used this for about 9 months. I've gone through 2 because I did actually lose one in Iraq when I was doing my pilgrimage last year, and that's because someone literally yanked it off my wrist in a kerfuffle. But apart from that, it's pretty good. It's very light. You barely even notice it's on your wrist and stuff. But I wouldn't rely on the metrics for this from a medical perspective. I think because it doesn't have the certification to back it up. But I still have seen patients come in with devices like this saying they're concerned. And for me, there's that element of suspicion because I know it's not approved and it's not validated to give that kind of information. Yes, it alerts to concern, and if they're symptomatic, clearly we're going to go down the investigation route and that kind of stuff. And I think that's where a lot of our colleagues will probably find themselves with these kind of devices. It's an alerting device, potentially, but I don't think it's reliable. That's the problem. How much anxiety does that then feed into is the question.
I consider them really, the way I conceptualise it, I think it's screening, really. It's highlighting that there might be an issue with heart rate or with some other metric, and then we need to use our proper approved diagnostic approaches to those. So that's how I'd conceptualise that. And yet, you allude to a very important point, which is we never had this data before. We never had people walking around monitoring their heart rate 24 hours a day. We don't know what's pathological, what's normal, what needs treating, what doesn't need. But what we do know is that when something tells someone that their heart rate's abnormal, they can become worried. So I think we've just got to navigate our way through it because these devices they're here. People are going to use them, and we need to find a way through. But how we do that, I'm not sure. Perhaps our cardiology colleagues need to give us a steer. Perhaps there needs to be some.
I think it's something we're going to see increasingly. We will even see dedicated devices that try and do this. So some of our eGP learners will remember our episode that we did about a year ago on the Alive Core Cardio device that both me and Andy have in practice. So we're still using ours. We've currently got a flu campaign going on in practice. So if you're over 65, you can get a flu jab at our practice. You'll also get a cardio. 2 seconds tells you that it's a screening ECG tool, effectively. That can easily be considered wearable because you can stick it with your phone, and they've actually brought out versions that are even more diverse. So I think they've just released their 6-lead ECG version. So that's hot off the press, I think about a week or so ago. So a bit more metrics and potentially cardiac screening in terms of ischemic heart disease and that kind of stuff, because you get a bit more information. The only thing you don't get is the lateral leads and stuff. So for our medic colleagues out there. But the tech is growing. Like you said, it's here to stay. It's not going. It's not like we can just suddenly turn a button and switch it off, and people are never going to come see us with these kind of things again. So navigating it is a question.
Absolutely. So Gandhi, we've alluded to you're in the Google ecosystem.
Definitely.
I'm in the Apple ecosystem, and both are attempting to develop some platforms, health platforms, mainly based around the phone devices. And they have different positions on privacy as well, these companies. So maybe it's worth just talking a little bit maybe about Google's offer and Apple's offer.
Google at the end of the day is a data company. no matter what else they do, what they want is your data, because that's how they then market everything to you. Advertising, service provision, all that kind of stuff is based off the data that they get. And yes, how they share that data is always going to be a question. Yes, you can limit some stuff in terms of privacy settings, but privacy probably isn't the heart of what Google does. It's more about sharing information, because they know if they share information, they can find what you want easier, quicker, and that's what you want. That's why you Google it. Apple's a bit more privacy focused.
Yeah, and that's a position I'm quite a fan of Apple these days. I respect their position on privacy. You pay more for the devices. They're primarily a device company rather than a sort of data advertising company, and therefore you're not the product. So I just have more confidence, I think, that Apple know that I'm their paymaster and they'll do what I want with my data rather than. I suspect Google. I've not looked into it, but I suspect they probably give you the option to keep your health data private. Maybe that's even the default setting now, but you wonder where that'll go in the future, because the temptation to know that this person seems to be training for a marathon based on their activities. That's activities. It's not even just that's just your GPS location, your steps. Maybe that's not even health data. Really, it is, but maybe it's. On that, it's a blurry enough issue for them to think, well, maybe not, no, that's fine, we'll send this person advertisements for new running shoes or something like that, and I would just find that creepy, or let their health insurers know.
And we see this already with big data anyway. When you look at Facebook, you go on, if you use Facebook and then you, for example, decide you want to go search for a holiday, next thing you know in your Facebook feed you'll see loads of adverts for holidays, because that's how they keep track of things. Whether you're logged into Facebook necessarily or not, it's based on what you've used in the browser. But I guess the other question is, how much relevance does that data have for you? Actually, if you're the type of person where that makes your life easier, because Google knows that you're interested in this and then they're bringing that information to you, does that make your life easier? It's this privacy versus convenience dichotomy that we have in everything in our lives now. It's not just healthcare. Healthcare, it's more of an issue because we value healthcare data in a different way. It is your most personal data that exists. And that's why there are much more stringent requirements for everything when it comes to healthcare data and stuff. But it is that question I think sometimes people have to ask, is where is the difference between convenience and where is the difference between privacy? And that's also where a lot of conflict I think comes up.
And better products. I mean, Google's assistant, as we did Google in our digital assistants episode, they outperform Apple a lot, and that's because they collect so much data about what people are doing and saying and searching for, and that's how they're able to develop a better product in terms of digital assistant. And maybe that's with the price paying in terms of being more relaxed about your privacy. But it's sort of the question of our age, isn't it? This privacy issue. I was going to add, and I'm sure Google have done the same thing, but Apple in Apple Health, which is one of the apps that sits on our phone, are moving to create a sort of wearable health and fitness platform, I guess you would say, or ecosystem. So that's the sort of repository that stores all this data, and you can grant permission for other apps to access that data. So, for example, MyFitnessPal, which is a popular calorie counting, activity measuring app, can access the estimation of your calorie consumption on certain days, or not consumption, what you've burnt on any day, and access your steps and so forth. You can grant access to the information generated from your smartwatch to that, and it can also write information back in terms of, say, if you're logging your weight in the app, and put it back in. I think that's a very good move. I think it's necessary because people want these different apps and devices to talk to one another. They want control over the flow of information, which it gives you, but they want that. And also, Apple are partnering with research partners around the world. So people looking at how you can use the Apple Watch, for example, to and other apps to detect and monitor Parkinson's disease and all sorts of other things. So they're making quite a big health play, and the wearable technology in the Apple Watch is a big part of that. So I respect that. Are Google doing the same?
I think they are. I mean, Google's technology is slightly different. They push bigger behind the software behind it, so Google Wear, as they call it.
Yeah.
So and then they just have other providers create the watches. So like there's the Samsung Gear, or there's the HTC version, and other kind of companies have their own kind of versions of smart watches backed onto the Google platform, or Google whatever it's called. But that just brings us back to the data aspect. What Google then gets is the data, and that's what they care about. They don't care as much about the device, and that's why Google don't really make many devices. Okay, fair enough, they started with things like home speakers and that kind of stuff, but there's only one Google phone, it's the Pixel, whereas Apple has 4 phones, 5 phones, whatever, that kind of thing, and that's how Google like it, because they are a data software company, not a product company specifically. I guess people were asking earlier about what I'm currently using, because obviously I said this is what I used to use, and it comes into this data aspect of thing again. So I'm currently using something called a Muse. This is the grander version. Yeah, so we're going to come here so you guys can see.
Just a bit of glare there, Gandhi.
Sorry.
That's better.
Okay. So the reason why I've been using this, so this is a relatively new thing of mine. I've only had it for a week. And one thing I'd probably say is a little bit stiff with the band. It's a bit tight. But it's different because it doesn't have a digital display. So there are a couple of brands that have gone down this route. So it looks more like a watch, which is the first thing, which is what I kind of wanted. But it doesn't have a digital display. It massively plays with the app, so it's reliant on me having a smartphone and the app, and I get all the metrics and stuff through the app and things. It does give me notifications of buzzes and that kind of stuff, and I control a lot of functions with my phone with this. I can do Muse Pay, which is their version of Apple Pay and stuff. So one of the things we haven't talked about is that Wearables allow you to pay for things nowadays. So Andy mentioned earlier how he loves
Apple Pay is fantastic, and you can listen to podcasts on the Apple Watch, which I absolutely adore, because if you're out running, you don't want to take your phone with you, you can take your Bluetooth headphones, it's better. And actually that's the sort of stuff that gets these things on people's wrists.
Exactly.
And then they stay there, and then you've got the health.
It's the multi-functionality benefits. So I quite like this. It does have a couple of flaws, if I'm being honest, in just a week, like I said, so I've had to take the battery out and put it back in once already because it wasn't syncing properly. So that was a bit annoying to have to do that. And it does give me some metrics and stuff, but it's not bad, but it is a different way of engaging with the device than what I've been used to. I got this through Kickstarter, as many of my friends will know. I love Kickstarter. I spend far too much time and money on it, but it is available in other ways now. But this, I think, is what we'll see a little bit more of. The smart tech, but not necessarily looking like smart tech, because we're seeing more. So there's other companies like Withings and that kind of stuff that do these kind of things, and I think unnoticeable smart wearables is something we will see more coming through.
Yeah, that's probably my main criticism of the Apple Watch, because I love the Apple Watch. I've had one since it came out. In fact, I'll just show you on the other camera. Everyone's seen an Apple Watch anyway. There's the screen I'm currently using. But they're just so popular now. So you go to meetings, everybody's wearing an Apple Watch. Lots of patients that come in are wearing an Apple Watch, and for at the risk of being sexist, I don't know, but for guys, often you're not wearing a lot of other jewellery, or I'm not wearing a lot of other jewellery myself, and it's the one thing you use to kind of show a bit of flair and personality, but you find you're wearing the same watch as everybody. I was recently in Florida, and gosh, so many Apple Watches around, and that's the reason why for a while I stopped using the Apple Watch, just because I wanted to just use something different. But then two things, so I missed being able to see what the temperature was, the weather, and things like that. I found that quite useful. Oh gosh, loads actually, and control the lights in my house, which I like doing from my watch, and getting the health data. And I was quite invested. I had years of daily heart rate monitoring and activities and steps, and I thought this might be useful one day. Maybe it's not useful now, and I'm already in there. I've already kind of put that effort in, so I'll go back to the Apple Watch. So I bought myself a different band to make it look different, and then I went back to the Apple Watch. But I'm going a bit of a run here. But what I wish Apple would do is, how some of these Swiss watch manufacturers, they make the movements. So if you buy a tag or all sorts of different brands, they've often got an ETA movement in them, and they're very similar. these movements. In fact, they're the same, like these automatic movements.
Okay.
And they go in all of these different watches. And I just think, maybe Apple, they won't do it because I don't think it's quite what they do. They like to control everything. But if they made like the movement, the bit that goes inside the watch, like with the screen, and they let other people make enclosures that look different, then that would address this problem of wanting to express my individuality whilst wearing an Apple Watch. So I wish they'd do that. Bit of a tangent.
As you said, I don't think we're going to see that Apple-like control when it comes to their products. It's, like you said, it's the payoff.
Yeah, they'd have to conceptualise it as cases, I suppose. That's the one way they might be able to justify to themselves.
We'll see.
Yeah.
Cool. I think we've covered quite a lot there, haven't we? And we've talked about, obviously, the tech itself. We've talked about the usability of the tech. How this shares with data is one thing we're not focused as much on. And I guess that's one of the things we're seeing that may happen with, like the Google Health Vaults, the Apple Health Vaults, NHS app. How much these devices will be able to integrate with the NHS data, and I think that's one of the things we're going to see. There's also the issue of translocating that to primary care data, which is okay. I think it's going to happen. So conference season, as we mentioned earlier, seeing more and more of these kind of developers that are coming up with ways of taking that knowledge and putting it in the patient record. It's a question what you do with it at that point. It becomes a bit more challenging, but we're going to see more and more of that coming through.
That's where you get the benefits, I think, when you start to put the information together and link everything up. And I don't think anyone knows quite how that's all going to work or how we'll know what's relevant, but it's going to happen.
I guess for me, one thing would be to look at things like sleep trackers and stuff, because actually one of the things we know is that how you sleep has a massive bearing on your overall physical and psychological well-being. A lot of these things have sleep trackers in them. Using that kind of data actually to say to people, you're telling me you're not sleeping, actually your data says the opposite, or more importantly, the way around. Let's have a look at how you're sleeping. Oh my gosh, that's not good. We need to target your sleep to help your mental health well-being, because if we do that, you will hopefully feel better in yourself. And sleep hygiene is a massive thing, particularly in our modern world, because the tech has a bearing on that. Massive bearing. So that's one thing I would love to see, and that's one of the things I've started doing with a lot of my patients that come in with these kind of devices, and I've said, like I said, track how you sleep, and let's have a look. And actually, then making changes to those does have a noticeable benefit. I don't have the evidence to back that up. I'm sure it either exists or doesn't exist out there, but I think that's somewhere where I think in primary care we can see a noticeable difference.
Yeah, that's good advice. I suppose where I'm mostly directing patients to use this sort of wearable technology is around the weight loss lifestyle sort of element. Often it's visible what technology people have when they come in. Sometimes they've clearly got an Apple Watch or some sort of fitness tracker. Sometimes everyone's got a smartphone, and I'm advising people more and more to look at calorie counting and activity tracking apps to give them a little bit of guidance in terms of losing weight. Can't say how successful it's been so far. We'll see if some of those patients come back, but that's probably where it's making most of an impact for me. And also, some people are coming, as we mentioned before, and saying that there's something strange about my heart rhythm or heart rate at times. But I'm sure it'll only grow and grow and grow in terms of its relevance for us. So let's start to pull things together or something up. So we talked about a lot of the advantages. Any challenges that we've not covered so far? And I'm gonna give you one. So
go for
it. Older person in the family. Hearing's bad, and wears hearing aids, basically. So very early health wearable technology would be enormously transformative for this person's experience of the world and how they interact with other people in it. But won't wear them. And you say, well, if my hearing was bad, I'd wear hearing aids. But his reason is he doesn't want to look frail or old. So, and it's something about already being a bit frail and old and not wanting to add to that appearance. So I'm wondering, it's great for people who are training for their marathons and so forth, wearing these health technologies. But will the people who actually would benefit from it, if we're talking about fall detection, things like that?
Yeah, we mentioned that earlier, didn't we?
Would they wear it or would they shun it? I don't know the answer to that. But the concern.
If it's something that's more commonplace, like we mentioned with the Apple soft fall prevention kind of thing, actually if everyone's wearing them or similar sorts of things, then it's less of an issue, isn't it?
I think I think so.
Yeah.
But I think there's something about making sure the wearable technology is packaged
Yeah.
right, so that it's desirable for the right people.
Clearly, things like the iWatch are marketed at the modern kind of person with lots of devices and that kind of stuff, because they've got the income to pay for it, generally speaking. But I can definitely see where you're coming from in terms of that perspective aspect of it.
Yeah. Any other challenges that you can think of, Gandhi, that we've not covered so far?
I think for me the biggest one is this whole concept of clinicians accepting the information these devices can give when we're looking at it from this perspective. I think that's always going to be the heart of the problem, the evidence behind this. And this is one of the things that we see a lot with technology. Technology gets this kind of pass when it comes to justifying the effect it can have, and particularly consumer tech. There's always this view that if I can do it with consumer tech, why can't I do it with my healthcare? And the same level of rigor and evidence and all that kind of stuff doesn't tend to be applied until later down the line, and we learn more about it. Whether that's right or wrong is always going to be a question. A great example of that is going to be vaping. So vaping, when it came out, everyone's like, yeah, it's got to be better than smoking. And actually, in America now, they're dealing with the complications of a particular episode of vaping being actually causing quite some significant ill health to people. And they still don't know if that's because of vaping or because of an issue with the contaminants in the vapes and that kind of stuff. So, and the general view, I think, is still it's probably slightly safer than smoking per se. My advice to all patients is if you're vaping, you vape with a view to stopping smoking. And that has to be the way it's used, not as a supplement or instead of smoking. But tech doesn't get the same rigor applied to it as everything else, and I think that's one thing that we have to remember. Even as an avid user of tech, when it comes to healthcare, you kind of have to have that perspective of, yes, it can be useful and effective, but at the same time it needs to be safe, and getting that dichotomy is that. Yeah. It's like the data question.
How do we get there? Because so many devices, so much data, pace of change much greater than it is, and there's a lot of opportunity there. I think the normal, your normal medical institutions that would decide what drugs and what interventions are safe probably aren't set up for that. I mean, is it down to the device manufacturers, those who create the platforms? That's where this all comes about.
No one's taking ownership of this. No one's willing to say that we will be the people that can give you that definitive advice. Companies will say, yeah, it's fine, go ahead. They want to sell these products. But where do you turn for that? I mean, we talked about this with Orca.
I was just thinking about that.
So they are an organisation that ratifies and evaluates health apps, and that's really useful. They build themselves as the BNF of health apps, which is great. That's something that clinicians can relate to and understand, and that concept and things. And I think we need that when it comes to medical technology as well. We need organisations to say, actually, this is appropriate, this isn't appropriate, this is sensible, this is not as sensible, that kind of stuff. And giving clinicians that, because once clinicians have that, there's a bit more safety, there's a bit more confidence, and that's when we will start to see sharing work more effectively. Patient confidence has to be there with these tech, but also we need clinician confidence to use these kind of products, because otherwise there'll be that massive resistance inherent in it.
Yeah, so maybe there's an opportunity for somebody to create the Orca for health technology somewhere. There's probably a business model and a funding model there. The industry could co-fund.
I think there's some aspects of the MRHA being involved in this from a medical prescription point of view, that there is moves towards that being done. But as usual, the rate of pace of change outstrips everything.
They'll be slow and underfunded.
Unfortunately, bringing bureaucracy into everything.
You perhaps need a co-funding model, perhaps with the device manufacturers, possibly, so that they can be resourced better. But very good point. So we need to try and wrap this up somehow, Gandhi. Give me a wrap up, but also I want a prediction.
Okay.
For where we'll be in.
So I think to wrap up things, we hope this episode has shown you what consumer wearables can do, first of all, and also how that may be applicable to you in healthcare, both as a patient and definitely as a clinician. I think we've shown that there are definite positives, and there's some massive cautions that come with using consumable wearable tech in primary care and general practice and that kind of stuff. And I think we are going to see, the reality is they're here, they're not going anywhere. It's going to be fine. It's definitely something we're going to see increased use of. My hope, and I guess my prediction, is that we will start to use these a lot more effectively within general practice. We are undergoing a digital revolution in general practice. The advent of things like online consultations, the advent of network working, that kind of stuff. There are changes in terms of innovation and stuff, but I think in terms of how we use this kind of tech, we potentially will see chronic disease management shifting towards this, to people having the information, and hopefully with that, this is my wish, better self-care, because that's what we actually need these devices to do. Less reliance on the healthcare service to help advise you about how to manage your health, and better information for patients to be able to manage their health independently with the support of the healthcare providers, because otherwise our healthcare service ain't going to last. That's my view.
Yeah. Okay. Good. I'm going to give you where I would love us to be.
Okay. Go
in 5, let's say 10 years time. So what I would love is that I'm going about my normal business, and I get a message on my smartwatch, and it says, "Oh, your GP's virtual assistant wants to schedule a video call with you." But this is about everything being joined up together.
Okay.
So I think alone, big impact; joined together, like massive impact. So yeah. So notification: my GP's virtual assistant wants to schedule a video call with me because they've become aware that I've been having episodes of moderately increased heart rate during sleep, and they now know from all the data they've collected that this can be an early sign of an impending problem potentially with my health. And they know from the genomic data that they've got about me that I'm particularly susceptible to this, and that actually a particularly effective intervention would be for me to change my activity pattern and get up earlier in the morning and do some exercise then. And if I do this, and they can monitor whether I'm doing it or not and give me a nudge, then I can avert an impending health problem, and that's because they've joined all of this stuff together. I would love it if that worked like that. And maybe even I never spoke to the GP as well. Just his virtual assistant that allows him to do all of this new work that while he's dealing with the very sick and very frail, he doesn't even have to do it. He just it can highlight a bigger problem that he needs to intervene in if he needs to.
I think what's interesting with that is I see it slightly differently, in the sense that I see that information still all being held by the patient. So it's not that interfaces with the healthcare provider to give you that advice, because you're effectively talking about AI, you're talking about monitoring, talking about sharing health data, all the data kind of things we discussed earlier. But then that alerts the GP to trigger that concept of, does this patient need that interaction? And that's when the contact happens, not the automatic other way around. Because don't forget, we still have silo working. You're under a consultant if you're under secondary care, and maybe that's what we need, integrated healthcare providers. But then that has an impact on who's delivering your healthcare.
I wasn't really meaning to give any messages about that. So for my experience of the user, I experience it as this is my GP caring about me, but that might not actually be the reality at all.
Time will tell.
It's something completely different might happen in the flow of information. Yeah. So, but anyway, maybe that's an interesting place to end. So.
So yeah, I think we're going to say thank you guys for listening to us. We hope you found this episode useful. I think one thing we would love to hear is your perspective on this. What do you guys think? Do you think that consumer wearables are something that's going to create a seismic shift in the way that we practice healthcare? Do you think it's going to shift how healthcare is delivered? And more importantly, what's your experiences so far? I mean, have you had the my heart rate's pounding consultation, and if so, how did you handle it? Yeah,
did it uncover something significant or not? And also, is it just a flash in the pan? Is it something that general practice in the NHS should not be getting involved in at all? People may have a variety of opinions. You can get in touch with me via eGPlearning and Gandhi's ways of getting information in, and also Twitter at Dr. A.W. Foster.
I'm on Twitter at Dr. Gandhi52 or at eGPlearning. If you're still here watching us on the YouTube channel, leave us a like and definitely comment. We want to know what you guys think. So leave us one on the platform, and on the podcasting stuff, guys, you know where we are: Facebook, YouTube, Instagram, LinkedIn, Twitter, everywhere. As usual, feel free to contact us. We'd love to hear from you.
Cool. So that's the end. Thanks very much for listening to the very end. Goodbye.
See you later, guys.